Studies have shown that adolescents or young women as young as 8 can be diagnosed with endometriosis.
Unfortunately, it often takes 3 times as long to diagnose endometriosis in young women than it does in adults.
The difficulty is when that girl is young and you can't assess things like intercourse pain or trying to get pregnant, then really it's a matter of trying to discuss with the girl and not dismiss their symptoms.
Endometriosis can actually occur and develop at any age, and I think that's an important thing for us to remember. There's an old wives' tale that teenagers don't get endometriosis, and that's a myth. That's an untruth.
Most girls that have endometriosis, or young women, have it from their first period or very early on.
Saw a young 14-year-old who had extreme period pain and was missing school frequently. She was labelled as a nuisance or a brat by her teachers, and this affected her greatly. When we discussed her symptoms and started some treatment for endometriosis, her symptoms improved drastically. Her quality of life significantly improved. She was able to attend school and is now much happier, having diagnosed endometriosis and having this treated appropriately.
We're often asked about whether this is endometriosis or whether it's just period pain, and it's a really good question because they can be quite difficult to discern. Period pain is one of the commonest signs of endometriosis, but not the only sign. And not everyone who has period pain will have endometriosis. Here the important things are to try and deal with period pain, and actually the treatment for period pain is often similar whether you do or you don't have endometriosis. So simple treatments like starting with an anti-inflammatory program, thinking about if you've got a regular cycle, starting to take those medications just before the onset of menstruation, and that means before those chemicals that are being released at the time of period get into the circulation and start having their effect on the body, can make a big difference to pain symptoms.
When endometriosis becomes more severe, you can start to develop other symptoms outside of your periods, and you can start to develop pain associated with bowel and your bladder, and then those things can help me to decide whether it is just period pain in the absence of endometriosis or whether it really is endometriosis.
So if an adolescent is experiencing pain or painful periods, it is important to address that and acknowledge that they could potentially have endometriosis and manage it accordingly.
Red flags for period pain is when the pain is consistent, debilitating, and impacts on a young person's ability to go to school, play sport, and hang out with their friends.
The pain that seems to be getting worse with time. So as a girl ages, she gets worsening period pain rather than lessening period pain, which is more a feature of primary dysmenorrhea, or that menstrual pain you get at the beginning of menstrual life.
If your pain is not responding to simple measures such as medication, pain relief over the counter, or even the oral contraceptive pill that may be trialled, it is important to speak and see a specialist in endometriosis to address your concerns.
It's the same symptoms that adults experience, but we often dismiss them in young women, thinking that they'll grow out of it.
We often see exactly the same symptoms of pain in adolescents that we might do in people who present with endometriosis at a later age. We know that the commonest time to get a diagnosis of endometriosis is when you're in your 30s. However, people as young as 10, 12, 13, those people who are just starting to get their periods will often have period pain, sometimes pain in between their periods, sometimes pain when they use their bladder and bowels.
Unfortunately, it can take much longer for a young woman presenting with the same symptoms compared to an adult to be diagnosed.
When young women start having periods, it's such a new sensation And I find the hormonal shifts in adolescence are so great. So young women starting periods can often have really, really heavy periods as compared to later in life. So it's quite common for periods to start relatively heavy and then they settle down in the woman's late 20s and early 30s. And what comes with the heavy periods is also pain. And I find sensation and perception of pain is higher in adolescence. So a teenager is more likely to feel that pain as compared to someone in their 20s and 30s.
It is important to have a GP who is engaged and takes their symptoms and the effects of endometriosis seriously. It's also important to have a good gynaecologist who can offer a range of treatments so that young women can decide what is best for them. And that treatment may change as they get older.
Ideally, someone who's equipped to treat them, so an adolescent or paediatric and adolescent gynaecologist would be optimal, or anyone who really has a lot of exposure to adolescence and menstrual pain.
Pelvic physiotherapists are a great resource for young people with endometriosis. If we can establish good functional control of the muscles early and good exercise habits, hopefully then we can prevent some of the downflow effects of endometriosis. And this pelvic physio does not need to involve a vaginal examination if the person doesn't want one.
For young people with endometriosis, the variety of treatments that we have is pretty much the same as what we have for adults. Now, that includes lots of different types of approaches, a self-help approach, so we talk about diet, exercise, meditation, yoga, things that the person can take control of themselves. That's often very helpful. We think about non-hormonal types of approaches that might be useful, things like anti-inflammatories and other types of pain-relieving medications.
And then moves on to hormonal therapies and then finally to the nerve-blocking type agents. In terms of the pill and hormonal therapies, it is actually safe to take during the adolescent years.
And in some people, we might use the levonorgestrel intrauterine system or an IUD that releases progesterone into the uterus. Commonly, that needs to be put in under an anaesthetic, and so we need to think about that if that's going to be a treatment modality for the young person.
So the best treatment for adolescents is sorting out what their symptoms are and exploring what the possible factors are that might be exacerbating and triggering and worsening those symptoms, because everyone's pain perception is being modified by lots of different factors.
What you want to do is you want to tell them about the risks and benefit of each of the treatments that you're describing to them, and I will always like to start with what's the least risky and might give them the most benefit. What you want to do in any treatment program is bring them back. Make sure that they're getting some response, make sure that they're feeling heard, and if they're not, think about what that next step is.
And you have to treat a young adolescent, often they're before the age of consent, which is 14. So they're often presenting with a family member, usually a mother. Sometimes the young woman knows what she wants, and often the parent will come in being quite worried about something like the pill, thinking that that young girl is going to embark on being sexually active or might take a few more risks sexually because they won't worry about that. There is absolutely no evidence that that is the case, and I always reassure mums about that. And I think that really trying to educate both the mother and the daughter around what the best therapy is going to be, and that at the end goal is really to get that woman out of pain and to get them to a point where they can function again at school and in their daily lives. And so trying to find the best therapy for that is the goal. But it takes a lot of time to manage both parental expectation as well as the teenager's expectations.
Some teens are more at risk of endometriosis. Anyone with a family history in their mother or their sister are at much higher risk of having endometriosis. We do know that certain genes increase the propensity for endometriosis. So if you have a family history and you are experiencing the same symptoms as your sister or your mother, then it's important that you take your symptoms seriously.
As a general rule, about 1 in 10 women have endometriosis, and if you have a first-degree relative, you are 7 times more likely to develop endometriosis.
Our biggest problem with diagnosis around endometriosis is we don't have a simple test, be it a blood test, a saliva test, a urine test. So we're relying on a conglomerate of symptoms that the person presents with, and then other investigations like an ultrasound.
An ultrasound on the tummy can diagnose endometriosis when it involves the ovaries. An internal ultrasound is better at diagnosing deep infiltrating endometriosis. An MRI could be used for women who cannot tolerate or are not suitable for a transvaginal scan.
Now, the difficulty in teenagers compared to adults, where you can rely perhaps a bit more heavily on things like ultrasound or MRI, is that as time goes on, endometriosis is fed with hormones. So the more cycles you have, the more hormones you have, and then you're more likely to get more severe endometriosis. You can do a laparoscopy at any age, including the newborn age. The problem with doing surgery looking for endometriosis is that the more surgeries you do for endometriosis and removing it, the less improvement you get in your pain. And if you start doing surgery too early, then if you think about it with the menstrual pain, if you start at 15 and you're going to have a period till you're 50, then and you require a surgery every 5 years, that's a lot of laparoscopies to go through, and that's probably not best practice for that woman's life and her well-being.
We certainly don't like doing surgery on young people, but sometimes it's necessary. And so in that circumstance, you want to consult widely. You want to think about all of the options. You want to have a good discussion about what the risks and benefits are. And then you want to make sure that this is actually the right thing for this person at this time.